Many of us get one every year, paid for by our insurance. Called a wellness exam or physical, the visit is free through most insurance companies.
I said, as long as it's free, then I will go. So they scheduled my appointment for the free wellness visit.
Sherry Wiles is a patient at Primary Care Wake Forest Family Medicine in Louisville.
He came in and he went and asked me questions, which they do on the wellness exam and everything else. And he said, you haven't had one? I said, not to my knowledge, because at that time I didn't think I'd ever had one.
Wiles says the exam was rather routine. She did ask about her cholesterol medication, asked about a prescription to quit smoking, and wanted a DNR in her file.
He asked me if I had any other problems going on, and I said, yeah, my right eye was bothering me.
The entire exam lasting less than an hour. Just like that, her free wellness exam was done. Medical checkups play out in millions of doctors' offices every year. Wiles Hewett had his last one in 2020.
I knew this exam was free.
His doctor also in the Wake Forest Baptist health system, but unlike Sherry, Stephen had to fill out a form.
If you talked about anything outside the parameters of the physical itself, then you would be charged an office visit.
Basically meaning the exam would not be free. Stephen says he didn't ask a single question, only answering the doctor's.
She did all the asking. She asked all the questions, went through my medical record chart, and that was it.
Much like Sherry, the visit was relatively quick, and he left. Now, weeks later, both patients are reaching out to News 2 crying foul, charged for their free wellness exams.
So next thing I know, I turn around and get a bill for $446.
So I was at a loss as to why I was being charged.
We reached out to Wake Forest Baptist to ask them about both cases. Initially told it would investigate, we received this email a few days later stating it could not comment on specific circumstances while providing this statement. Wake Forest Baptist Health takes the health and well-being of our patients very seriously. Our goal is to always demonstrate the highest standards of patient-centered care. When patients have a concern, we work with them to find a resolution. Sherry sees it differently.
I said, you're doing wrong to seniors. I said, they expect to go in there for a free exam, and then you turn around and bill them.
We again reached out to Wake Forest Baptist, leaving multiple messages and sending several emails, asking for answers to a list of questions we sent related to these free wellness exams. 3 months later, a spokesperson returned our calls, declining to answer our questions while telling us the health system had no further comment.
There has to be hundreds, if not thousands, of other people, and if Wake Forest bills people like this, then they're bringing in tens of thousands, if not millions of dollars off of fees that should not be charged.
To be fair, we don't know what was said in the exam rooms, both doctors apparently feeling the checkup fell outside the scope of a free exam. Wake Forest Baptist declining to share their policy, so we reached out to Cone Health and Novant, wanting to better understand what Sherry and Stephen believe is fraudulent.
I think it's fleecing of the patient. The doctor should say, look, if we start talking about this, this will be an office visit. Do you want to continue?
Here's the statement Cone Health sent us. The practice will verbally notify the patient that any other concerns addressed above the preventative visit will generate an additional charge. They also provide the notice in writing. Novant sending us this statement. Ensuring our patients understand every aspect of their healthcare experience is a priority for Novant Health. In addition to patient education materials explaining what services may not be covered during an annual wellness visit, our providers used shared decision-making to ensure the patient is the one who decides when they'd like to pursue additional services.
I think a doctor has a responsibility of informing a patient if they are going to start asking questions outside the parameters of the exam.
Stephen and Sherry both say that didn't take place during their exams. However, after reaching out to us, Sherry says Wake Forest Baptist has agreed to remove all charges. Stephen telling us the medical facility has done the same for him, but the bill to his insurance company still stands. Kevin Kennedy, 2 Wants to Know.